Welcome to www.watsondentaldds.com. It's highly likely that you may already know people who have undergone dental implant treatment and hopefully their experience has been positive. Dental implants can be excellent for replacing missing teeth, and this treatment is fast becoming the gold standard for dealing with tooth loss. In spite of this, how much do you know about the treatment and what to expect? What is a dental implant and how does it work? Dental implants are actually pretty straightforward, generally consisting of three separate parts that include an implant post or screw that is inserted into your jawbone, an abutment that is attached to the implant post or screw and which protrudes just above your gum line, and the final tooth restoration that will cover up the abutment. The idea behind using a screw or post is that it will bond with your jawbone during a process called osseointegration. This is where new bone cells begin to grow on the specially treated implant post, eventually holding the post firmly in place so it cannot move even a fraction. This bonding process helps to ensure the implant post is strong enough to hold a replacement tooth. Dental implants can be used to support implant crowns, bridges or complete dentures. Why is dental implant treatment often better than other alternatives? One of the reasons why implant treatment can be better than other alternatives is because of the way the implant post artificially replaces a tooth root. Your natural tooth roots are important for good dental health. Every time you bite down on a tooth, the sensation is transmitted through the crown of the tooth or the part you can see in your mouth, right down through the tooth root and out into the surrounding bone. This has the effect of stimulating the bone so that any old bone cells are continually replaced. Once a natural tooth root is removed, this no longer happens and old bone cells are no longer replaced and the jawbone gradually begins to resorb. Most of this resorption takes place the first year after tooth loss, which is why it's so important to think about replacing lost teeth as soon as possible. Dental implants can also be more aesthetically pleasing, especially when used to replace single teeth. A top-rated dentist can create beautiful new implant teeth that are amazingly realistic, using the highest quality materials. We make sure these teeth are designed to provide the correct amount of support for your cheeks and lips, avoiding that sunken-in look that can be so prematurely aging in people who have suffered multiple tooth loss. This treatment can be fantastic for people who have uncomfortable dentures and who hate being limited to easy-to-chew or softer foods. With dental implants, eating should be more pleasurable and teeth will be held firmly in place, making it easier to socialize with complete confidence. For people who lost teeth many years ago, replacing them with implant-supported teeth can also help rejuvenate their appearance, as often the dimensions between their upper and lower jaws will have been diminished by bone loss. Restoring the correct dimensions provides the proper support for cheeks and lips, helping to fill out fine lines and wrinkles. Getting started on the treatment process. If you are missing teeth or are facing tooth loss, then initially you will need a consultation with a good dental implant dentist. During this first consultation, a dentist will closely examine your mouth and will want to know your medical history to determine if dental implants will be helpful for you. Generally, dental implants can be used to treat most cases of tooth loss, but there are occasions when an alternative solution may be preferable. A really good dentist will carry out a very careful assessment and only recommend implant treatment if they feel it's suitable for you. If you decide to go ahead, your dentist will need to take X-rays and a carot scan, and we may want to take photographs and possibly dental impressions to plan initial treatment. This might seem like a lot, but when the time comes for the actual surgery, it's important for your dentist to know exactly where to insert the dental implants for optimal results, and this ensures treatment is faster and more comfortable for you. What to expect during surgery? The actual procedure to insert a single dental implant is surprisingly quick and can be completed in as little as an hour. Often treatment can be completed under local anesthetic, but it's up to you, and if you are nervous then please talk to your dentist so they can provide you with additional sedation. The best dentist will want to make sure you feel comfortable at all times and are relaxed as possible during your visit. If you require multiple dental implants, then it will take a bit longer and additional sedation might be helpful. Once the implants are in place, They must be left to heal and integrate with the jawbone, and this generally takes at least 3 months. One thing we know lots of people worry about is if they will be left without teeth, and we would like to reassure you that we will not leave you without a smile. With some implant treatments, it's possible to attach new teeth quite quickly, but your dentist will always provide you with some sort of temporary restoration that should look and feel pretty good until your permanent teeth can be fabricated. Your dental office will also give you loads of information on how to care for the surgery site while it heals. It's not unusual to feel minimal discomfort, if anything at all, particularly after just having a single dental implant. However, a prescription for pain relief can always be provided, or advice on over-the-counter painkillers just in case you are at all uncomfortable once the anesthetic wears off. Completing treatment. Once your implants have fully integrated with your jawbone, we can provide you with your permanent teeth. These will look far better and will feel more comfortable than your temporary teeth, and you will be able to use them to bite into food and to chew quite normally. This can be amazing for people who previously had complete dentures, as the range of foods they can now be eaten will be far greater, making mealtimes that much more enjoyable. Looking after your implant teeth. With the correct care, your implant teeth should last for many years, but it is important to make sure you keep your dental implants clean. This is simple to do, and your dental team can provide you with lots of information on how to brush and floss your dental implants, or how to use other tools such as interdental brushes to keep them clean. It's vital to keep up with your regular checkups and hygiene appointments, even if you have lost all your natural teeth, as we can keep a close eye on your dental implants and your overall oral health. Losing a tooth can significantly disturb your quality of life, creating some difficulty in everyday activities like eating and speaking. Although modern dental restorative procedures have resulted in a considerable reduction in the number of teeth extracted each year, many people still have one or more missing natural teeth in their mouth. What is a dental implant? A dental implant is a fixture that is embedded within the jawbone and replaces natural teeth by supporting a prosthesis, such as a crown or removable or fixed denture. After the placement of dental implants, bone formation occurs in the surroundings of the implant, resulting in firm anchorage and stability of the artificial tooth. How do dental implants work? The success and excellent durability of dental implants is dependent upon their ability to form direct contact with the surrounding jawbone. This process is known as osseointegration and ensures that any prosthesis that is placed over the implant remains retained and stable, thereby restoring optimal functioning of the artificial tooth. Who should get an implant? In general, any person who has one or more missing natural teeth is a candidate for an implant. You should consider getting an implant if you want a long-term and durable replacement for your missing natural teeth. You want to restore your facial aesthetics by getting your missing teeth replaced. You want to eat and speak without any difficulty. You want to get rid of your inconvenient and uncomfortable dentures. Why are implants better than other dental prosthetics? Dental implants are gaining widespread popularity as the most convenient and durable replacement option for missing teeth. Let's have a look why you might prefer them over other tooth replacement options, such as dentures and bridges. Enjoy a beautiful smile. Loss of a tooth can ruin your smile and facial aesthetics. Aesthetically pleasing dental prosthesis can be placed over the implants, thereby restoring your beautiful smile and charming appearance. Durability. Unlike the dentures and dental bridges, dental implants are designed to last forever. If you take proper care of your oral health and adhere to your dentist's instructions regarding the care of the implants, you can expect them to function for a lifetime. Minimal requirement for tooth preparation. Fabrication of teeth bridges, even for the replacement of a single tooth, requires reduction of the adjacent teeth as well. On the other hand, placement of dental implants does not require any preparation or reduction of the adjacent teeth, thereby preserving the natural tooth structure. Eat any food you like. People who wear removable or fixed dentures have to avoid eating hard and sticky foods. This means they have to miss out on many of their favorite foods. After replacing your teeth with dental implants, you can enjoy all of your favorite foods without having the fear of breaking or dislodging your dentures. Improved oral hygiene. Maintaining optimal hygiene around dental bridges can be difficult as the bristles of the brush are unable to remove food particles from beneath them. As a result, additional oral hygiene measures may be required to achieve optimal dental health. Unlike dentures and bridges, you can clean your dental implants exactly the same way as you clean your natural teeth, allowing you to maintain excellent oral hygiene and physical health. Comfort. Dental implants are embedded within the jawbone just like your natural teeth. When you replace a missing tooth with a dental implant, you get the same level of comfort, convenience and natural feeling as you have with your natural teeth. How are they placed? Placement of dental implants is usually carried out in multiple stages. However, single-step implant placement procedures are also gaining popularity. The following steps are involved in the placement of dental implants. Formulation of a treatment plan. Before placing an implant, your dentist will have a detailed look at your medical and dental records, followed by performing an extensive clinical examination of your oral cavity. This is done to make sure that you are a suitable candidate for getting an implant, and to prepare a treatment plan that is tailored according to your dental needs. Administration of anesthesia. Since implant placement is a surgical procedure, your dentist will anesthetize the region where the implant is to be placed, so that you remain comfortable and pain-free throughout the procedure. Reflection of soft tissues. In the next step, your dentist will make an incision over the oral soft tissues, so as to expose the underlying jawbone. Placement of the implant. A hole is drilled inside the jawbone, such that it is slightly narrower than the actual thickness of the implant. The implant is then carefully tapped or screwed into position by applying precise and controlled forces. Provision of a prosthesis over the implant. In case a two-step implant placement procedure is planned, a healing abutment is placed over the implant and the overlying soft tissues are sutured to allow healing of the surgical site. Once healing has taken place, the healing abutment is removed and the prosthetic is mounted to the implant. Alternatively, if immediate implant loading has been planned, a prosthetic is immediately placed over the implant. Please visit our site to www.watsondentaldds.com for more information on dental implants. Greene.